The NFL is constantly under criticism for its handling of head trauma during games and after players retire. There is no question football is a dangerous sport. To limit the severity of head trauma and its consequences on players, the NFL developed a game day concussion diagnosis and management protocol. Here is a brief summary of how the NFL handles concussions. The definition of a sports-related concussion is a traumatic brain injury caused by a direct blow to the head or by a secondary blow to the head, such as the ground. Signs of concussion include loss of consciousness, seizure, fainting position, which refers to the abnormal positioning of the arms in the air after a severe blow to the head and usually indicates severe injury to the brainstem. Slow getting up, motor or coordination problems, and memory disturbance. Symptoms of concussion include headache, dizziness, balance problems, amnesia, light and sound sensitivity, cognitive slowness, ringing in the ears. What is unique to the NFL is that on game day, there are several staff specifically dedicated to head trauma. Each sideline has one unaffiliated neurotrauma consultant. The only job of this impartial physician is to diagnose concussion and assist in the appropriate management. Keep in mind that the head team physician is ultimately responsible for the diagnosis of concussion and the decision to return a player to a game. There's a third neurotrauma consultant in the booth, and this physician reviews video and audio to review any suspected injury. And there's also a booth athletic trainer who also uses video and audio to review any suspected injuries. Additionally, the spotter has radio communication with the head team physician, the unaffiliated neurotrauma consultants, and the game officials. Notably, the booth athletic trainer can directly notify the game officials if there's anyone on the field who is suspected of an injury but has not been noticed yet. So the booth athletic trainer can notify the game official to stop play to allow medical attention for the player. 60 minutes prior to kickoff, all medical staff from both teams meet in the referee locker room, where they discuss the location of the ambulance, the spine board, the defibrillator, advanced airway equipment, and discuss the emergency action plan, as well as discuss the locations of any nearby medical facilities. Sideline concussion assessment, there are multiple components. There are no-go criteria such as loss of consciousness, seizure, and fencing posture. Concussion signs and symptoms are reviewed. Maddox questions, which include which venue are you in, which half is it, who scored the last point, who did you play last week, did you win last week. The video is reviewed, a focused neuro exam is performed, focused neurological exam is performed, cervical spine exam is performed, speech is evaluated, gait is tested, eye movement is assessed. If there was no concussion diagnosed after this, the player can return to play. However, if there is a concussion, the Madden rule goes into effect. The Madden rule states that a player diagnosed with a concussion has to leave the game and be observed in the locker room. The return to participation protocol is very systemized and structured. The decision is confirmed by an independent neurology consultant. This is a phased protocol where symptoms were closely monitored. First phase is symptom-limited activity, which includes light aerobics and everyday activities. Second phase is aerobics and team meetings. Third phase is football-specific exercise for 30 minutes. Fifth and final phase is full contact. As you can see, the NFL has attempted to standardize the diagnosis and management of major head trauma. However, concussions and major head trauma continue to occur, and this requires the NFL to always revise these protocols and guidelines in the interest of player safety.